All right. Hello, everybody. And I am so excited today to be here with Diane MacDonald, who is in Antrim, New Hampshire. And in addition to her private practice as a practitioner who helps people with all of their abdominal distress of many varying forms, she is also the head of the training program for the Arvigo techniques of Maya abdominal therapy. So she has a huge breadth of experience. And Diane, thank you so much for being here today.
Thank you, Isabel. It's a pleasure to share this information with you and whoever will be joining us. Thank you.
You're welcome. Great. Okay, so Diane, would you like to just give us a sort of rundown on how you came to this work in the first place?
I will, Isabel. Like most of us, we have our circuitous stories that lead us with our own health and healing. And I would say probably in my early 40s, I had many issues with menstrual problems. And to make a long story short, I was working as a registered nurse in a community hospital. And I was extremely unhealthy, eating, drinking diet soda, not taking care of myself. And eventually started studying herbal classes with Rosemary Gladstar in Vermont.
Yes.
And learned a lot about herbal preparations for menstrual problems, and it helped a little bit. One of the weekend conferences that Rosemary still does to this date is called the International Herbal Symposium, and they're in Wheaton College in Massachusetts. That's where I met Rosita. And it was an interesting meeting because at that time she was lecturing on Mayan womb massage, Mayan uterine massage, if I can remember correctly, to which I thought was a joke because you can't massage the uterus at all. But what did I know, right? At that point, I was finishing my master's in nursing to become a nurse practitioner. And I would see Rosita and Miss Hortense walking around the college campus, and I'd still be intrigued, but not intrigued enough to sign up for her class. And as the story unfolds, it was a long, hot summer day. I ended up in her workshop by mistake because it was a hot summer day, and where she was talking was an air-conditioned room.
Uh-huh.
Thank heavens. And within 10 minutes of her talking, I knew I had to learn this work. It all made sense to me. It wasn't just about massaging a uterus. It was looking at health and wellness through traditional eyes, but also science. And being that nurse of scientific mind, I got it. I got it. At that time, she was only coming to the States once a year to do some lecturing about her class called self-care. Mm-hmm. And she hadn't even figured out the professional care level yet. So I took her self-care class. And to be honest with you, in 3 months, I didn't even know I was getting a period. It was really a mother miracle of all times. So, of course, being the cynical person that I am, I stopped doing the self-care. And the self-care massage is something everyone is taught when you take self-care class. And I did it religiously for a few months. I got better. I changed my diet. I did some herbs. I was feeling great. It can't just be this massage, right? So I stopped doing it. And within a month, all my symptoms came back. So that was my profound part of wanting to know more and understanding how can I can treat myself, but now how do I get this word out to others? How do I make an influence in healthcare that's non-invasive, non-pharmacological? I don't need surgery. In fact, my medical doctor at that point was saying the only thing they would recommend is a hysterectomy because I was in my 40s and I wasn't going to have any more children. But, that didn't seem like a normal option for someone with menstrual pain. So even they were surprised. And no one would believe that a simple external massage would make a difference.
Yes.
And it does.
It does.
As it does. I'm now in my 60s and I still have my uterus. So that was my beginning of my healing, but also my curiosity of how this worked, why it worked, and started studying with Rosita eventually started teaching the self-care, and now myself, my husband, and we have 2 other employees here that really promote the training worldwide. So we've been able to technically see our baby grow. And, and it's been a privilege to work with Rosita and learn from her and learn from each other, because we have an amazing group of practitioners from different professions is where it comes down to. Mostly we're massage therapists. I would say there's some acupuncturists, medical doctors, naturopathic doctors, nurses. Anyone who has a hands-on license to legally touch is eligible to go into professional training. So that is the long and the short of it.
Fabulous.
For me.
Yes, absolutely, absolutely. And so this piece of self-care, honestly, so this is something that we have strongly in common, which is this belief that self-care is really essential to these healing processes, especially in the belly. It's one of the most accessible places we can touch in our bodies, and it's the potential for self-care there is so profound. And so I know that with the way that, and I think because of sort of where it started with the self-care and then grew into the more professional level over time with what Rosita Arvigo was doing and is continuing to do, is that oftentimes the Arvigo techniques tend to be associated just with fertility or just with the uterus or just with the prostate. But I really, the training is so robust that you all do that it's really applicable to so many different ailments that can happen in the belly or different structures, different organs. It's not applicable just to the reproductive organs. So can you maybe talk a little bit about that?
Exactly. I think that's a good question, Isabel, because in the beginning, it was just about, it was more focused on the uterus, but we started realizing, look at the different organs in our bellies. And we as humans, we have our organs, they have their structure and function. But as humans, we are comprised of being physical, emotional, and spiritual beings. We all have stories, and our bellies hold our stories, whether they're positive, negative, not, there's no judgment applied to it, but you don't live to be a certain age and not have a few stories.
Right.
And we hold them in our bodies, and our tissues hold them too. So we draw a little bit on the work of Wilhelm Reich. Our issues are in our tissues. And we have armor rings in our bodies where we hold that tension. And when tension is manifested, then illness can happen. And how do we unravel the tension in our bodies to get us to health and wellness? Physically, we can do it. Emotionally, we can do it. And spiritually, we can do it as well. I think of the abdomen as, okay, so we've got our stomach, our liver, pancreas. We know our structures and functions of those organs. What happens when there's a surgical intervention or a car accident or a trauma? Organs can get shifted out of place. Scar tissue builds up. Scar tissue builds up, then that structure, that functioning around that organ part can be impacted. So we're always looking at improving homeostasis and hemodynamics. And how do we do that? There's a basic application that we learn in self-care and also for professional training. But then how do you adapt? How does the practitioner adapt the foundation to meet a client's needs?
Exactly.
And so that can be the challenging part, because we may all have the same organs, but our experience and how the organs manifest into diseases are going to be different for each one of us.
Yes, exactly. And that brings to mind, so there are actually quite a number of practitioners who have been trained in the Arvigo techniques of Maya abdominal therapy, and they're all over the world. And I love you all for that, because when somebody calls from other countries or different places in the United States or Canada, you name it, they can usually find somebody in their area near-ish by that has been trained, which is wonderful. Which kind of brings up this question. You're such a long-time practitioner, both in the medical world through your nursing and then through the Arvigo techniques. One of the things that I encounter is that even when practitioners have been well trained in how to work with the tissues of the belly, it's hard for them to feel confident or comfortable taking on what we would consider to be more quote unquote extreme cases. So in the case of having maybe large portions of the bowel resected, removed, maybe with the more profound problems that can arise from even a simple hysterectomy, implants within the belly in the form of internal colostomies and stuff like that. Can you maybe address how the Arvigo techniques do or don't sort of help practitioners with that?
Challenge. I call clients who come to us with those certain conditions. I call them our gifts that we learn from.
Yeah.
And yeah, I have an extensive background. I did surgical nursing years ago, but I recently had the privilege of working with a woman who had 2 ostomy bags. One was for colostomy for her stool, and one is an ileostomy for her urine. And she's someone who's fairly local and had done quite a bit of extensive research in getting to me. And for me, it was stepping back and saying, okay, I cannot treat her with this therapy in the same basic way that I was taught. I have to modify what I was taught in both worlds, my nursing world and the Arvigo world. And also remember that she's a client and she has her needs too, and her healing process that has to happen. So we did it. I met her, obviously, and her goal was not to cure from these 2 appliances. You can't turn them back. And the reason why she had them was for cancer. And the cancer was well caught in time, though it hadn't metastasized anyway. It was pretty straightforward surgical procedure. However, she was having a lot of bowel obstructions because of it. And the only surgery that can help her would be to go in and clean out those incisions, those adhesions, but the body makes more.
Yes.
So there we go back to square one again.
Exactly.
So fortunately, I think I've seen her maybe 5 times. She comes on a monthly basis, and her abdomen is now a different landscape. It's a different landscape in terms of the tension her belly was holding, in terms of the incision lines are now smoother. You still need incision in the body to hold the healing in place, but when it becomes overgrown, that was problematic for her. So some of the traditional healing, along with teaching her self-care, we had to modify to meet her needs. So for me as a practitioner, I had to step back and say, okay, this one is a receptacle for her urine. This one is a receptacle for her stool. She's still got the upper abdomen I can work on. I can still do all the posterior work for her. But what can she do for herself around the appliance changing time? Because patients need to change their appliances every day. So we worked out a routine for her, which she's doing. It's amazing when people are able to engage in their own health and healing, and they can start seeing the little bit of differences.
Yes.
That we've been able to do. And yeah, she's doing great, really great.
That's fantastic, because I think so often as practitioners, we get a little scared when somebody comes to us with that level of surgical intervention.
Right.
We get scared that even offering to work with this person may be overpromising, or that we're going to be so far out of our scope that we're maybe, I mean, I hear a lot of practitioners say like, oh no, it's too dangerous to do that, which, I think there's education that needs to be done there, but also, as you're talking about, when you can approach it from a holistic viewpoint, and also, what can I give the client to do to support themselves, it suddenly becomes a much more manageable process to help somebody through these things.
Exactly. And even with my years of experience, I was a little nervous, and we talked about that, and she was nervous too. The only thing, if I think about this woman who had enjoyed amazing health for almost 60 years, no, over 60, she's older than I am, and then all of a sudden to have all these surgeries and all of these interventions that no one had touched her body lovingly, not even herself.
Yes.
So to give that healing, and now she can lie on her belly. and it doesn't hurt, if it doesn't feel uncomfortable, and she can rub her belly and it feels good to her. You know, that's part of it. When we can start when I can start appreciating the gifts that she's giving to herself, I realize I'm just the conduit. I have to get myself out of the way. I had to go back and read, okay, so if this happened to her, what do I need to do? What's the safe space to work around so I'm not going to hurt her, injure her, or cause her any more problems? And we
Exactly.
worked that right out almost immediately.
Oh, that's beautiful. Yes, and so inspiring. So we have just a few minutes left together. Is there anything else you'd like to kind of throw into the conversation?
No, I would just encourage anyone, no matter what healing anyone is looking for, just start by rubbing your belly every day. I mean, really.
Yes. Yes.
Just even if you don't, just rub your belly and whatever feels good to you, and give yourself that sacred moments and time where you can just nourish and replenish ourselves. Because really, once we start feeling better about ourselves, we're better able to manage the stress in the world and whatever comes our way. But there are great practitioners out there, whether it's Arvigo therapy or whatever.
Yes.
You need to find what's going to work for you and study with those people who you're drawn to study with.
Yes. Oh, thank you. That's so beautiful. And I really appreciate your time this morning and all of your thoughts and wisdom. So thank you very much. And I encourage
Thank
people.
you, Isabel.
Yeah. And Diane, just briefly, tell us how people can find you.
The website is arvigotherapy.com. And the website's going to be getting a facelift soon, but that's a few months away. So you can contact practitioners pretty much worldwide. If you don't know where to get a practitioner or just need to talk to me, you can get me off the website as well.
Fabulous. Well,
Okay.
thank you again. Bye.